the relationship that a baby, an infant, has with its primary caregiver is the most critical element to providing that strong foundation for growth and development. So that's why we're taking a whole family approach in launch, is making sure that parents, caregivers, families, friends, neighbors, anyone who's interacting with a kid, a baby, and a child as they grow is really brought into the conversation around how can we all be healthy and promote the best environment and activities for enriching that growth and development.
I love that I get to combine mental health and kind of preparing for this really special time in people's lives that's also really hard. Maternal mental health has such a huge effect on infant mental health, and that's what we're trying to tackle.
Kids don't exist in isolation, right? They exist in the context of their systems, whether that's their family, their childcare environment, their school, their doctor's office.
If I can support the grown-ups, whether it's parents or grandparents, providers, teachers, nurses, whoever, in the best practices with a better understanding of development as well as social and emotional growth, then we just know that we will be raising generations of children who are better adjusted and more successful.
Many children spend a lot of time in early childhood programs, and we want them to be programs that are of high quality staff, high quality interactions, high quality activities.
So one of the most rewarding things that I have started realizing is just being that voice that says, how are you? Are you getting your basic needs? What have you done for yourself? And not as if that's an easy thing to do in this time, but that it's a necessary thing to do in this time.
So I love this work because we get to think about change in terms of a systems-wide change. So for example, if I can coach a teacher to have more positive interactions with their kids, then all of the kids that come after that will benefit.
The work with the teachers may not be immediate. It's like we're planting seeds, right? And we may not be able to see the growth of that. And when there are these moments of like beautiful revelation and like beautiful action to go with it, feels like, wow, I got the gift of seeing a sprout happen when all I thought I was doing was planting seeds. And it just reaffirms that this work is so important to give teachers really the tools and the confidence that they can make a difference.
When it goes well, it's really nice to be able to kind of meet people where they are and say, hey, why don't you try this? Or have you thought about this? And see change actually happen in front of your eyes and see the kid respond really positively. And then the teacher's like, I did that, that felt really good.
Starting to talk about, hey, how can we support you as a parent? How can you connect with your community more? How can you get involved in what your child is learning and doing and being exposed to? I think that we're impacting kind of the larger picture of public health as a community.
Well, I think it really boils down to something very simple. Healthy children make healthy families, make healthy communities, and we all benefit from that.